Nasal bone assessment. Protocol for assessment. The gestational period must be 11 to 13 weeks and 6 days. The magnification of the image should be such that the fetal head and thorax occupy the whole image. A midsagittal view of the face should be obtained. Criteria of the appropriate midsagittal face view. Anterior. The presence of the echogenic tip of the nose and the rectangular shape of the palate. Central. The translucent diencephalon. Posterior. The nuchal membrane. Technique. The ultrasound transducer should be held parallel to the direction of the nose and should be gently tilted from side to ensure that the nasal bone is seen separate from the nasal skin. The echogenicity of the nasal bone should be greater than the skin line overlying it. The correct view of the nasal bone should demonstrate 3 distinct lines. The first 2 lines, which are proximal to the forehead, are horizontal and parallel to each other equal sign. The top line is the skin and the bottom line is the nasal bone, thicker and more echogenic. The third line, almost in continuity with the skin, but at a higher level, represent the tip of the nose. Nasal bone assessment. The nasal bone checkup for either. Nasal bone visibility. Visible. The nasal bone line appears as a thin line, less echogenic than the overlying skin, it is not yet ossified. Invisible, absent nasal bone. Nasal bone length measurement with reference to gestational age. Nasal pathologies. Nasal hypoplasia. Nasal aplasia. Arynia. Single nares. Proboscis. Absent nasal bone.